evening. I'm Anneke Hesseling, and I'm very honoured to be receiving the South African MRC Scientific Merit Award in the Gold category. I'm a South African and a proudly South African clinician scientist, and my team at the Desmond Tutu TB Centre's work is really focused on translational research, clinical research primarily to address the needs of tuberculosis in children, adolescents, pregnant women, and other people that are marginalised. I'm a distinguished professor in pediatrics and child health here at SAMRC University and the Department of Pediatrics and Child Health at the medical faculty, and I'm the director of the Desmond Tutu TB Centre, and where I also hold a South African NRF SARCHI chair in pediatric tuberculosis. A major part of my team's work, and we really work as a team, has been to inform the design, implementation and dissemination of clinical research for the prevention, the diagnosis and treatment of TB and drug-resistant TB in children and other priority populations, specifically focusing more recently on therapeutic work for prevention and treatment of drug-susceptible and drug-resistant TB, and including the evaluation of novel TB drugs and repurposed TB drugs and regimen across phase 1 to phase 4 trials, and really conducting clinical research for impact. And this work has been translated into national and international guidelines and is really being implemented on the ground. The research at our centre is community and family-centred, with focuses on the whole spectrum in the care cascade, including social determinants of health, prevention, diagnosis, treatment through vaccines, treatment through preventive therapy, and also actual better ways to treat drug-susceptible and drug-resistant tuberculosis, and really focusing on the inclusion of those that typically are excluded from therapeutic trials: infants, pregnant women, children, adolescents, and people living with HIV. My team's work is extremely interdisciplinary, and we have expertise in clinical research, but also in epidemiology, large data, strong focus on social behavioral research and social determinants of health, implementation science research, and then trials for impact and for access. And all of this work is conducted in close partnership with government partners, including local TB services and other health services, our academic partners, but most importantly with the communities affected by TB. We have a very strong institutional community advisory board, or CAB, and they are really part of our research across the whole spectrum. I'm very grateful to be working with such a wonderful and dedicated team. It's a team approach. We are multinational, we're international, and we live in a place where there's a very large burden of disease, but where we can actually make a difference, given the extremely strong research infrastructure we have here. So I'm really grateful for the support of the South African MRC, not only for this medal, but for the multiple grants received to our group over the years, including for a pivotal trial which was recently published, the TB Chump trial, where this was the first funding we received for the study, and many of the younger people on my team receiving South African MRC awards and grants. So thank you to the South African MRC for the recognition of, not for me, but for our work, of the Desmond Tutu TB Centre, and for your ongoing support of our work in the past 20 years. I really appreciate it.